Welcome to the AMR Action Podcast. My name is Danny Peters, and I'm the Senior Advisor to the Canadian Antimicrobial Innovation Coalition, or CAIC. And I'm pleased to have here on our podcast Damiano de Felice, who is the Chief of External Affairs at CARB-X. And our listeners will know CARB-X very well, but might not know the acronym. Stands for Combating Antibiotic-Resistant Bacteria Biopharmaceutical Accelerator. And the very first guest on our podcast was Kevin Otterson, who's the founding executive director at CARB-X, so it comes full circle. And Damiano is here today to talk to us about the G7. Canada will be hosting the G7 in 2025, and AMR is a leading topic under the G7. And Italy hosted the G7 this year, and AMR was a topic that was covered. And also, the government of Italy made some commitments in AMR, which we're going to talk about today. So thank you so much, Damiano, for being here. We'll ask you a number of questions.
Thank you for inviting me.
So to begin, share with us your role within CARB-X and also your special involvement with respect to Italy's preparation for the G7 and AMR related discussions.
So CARB-X is an R&D initiative. We have an R&D team which manages all our external relations with the product developers, with the companies and teams in universities and academic centers developing products. And I'm responsible for managing all external relations outside of the R&D space. So I'm not a scientist myself. We have many great scientists at CARB-X. So I lead all the conversations about policies and actions that governments should take with respect to AMR. And so I fundamentally represent CARB-X whenever we need to speak about like what governments and private foundations and investors need to do something about antimicrobial resistance. With respect to Italy, I was lucky enough to be Italian and to be based in Italy as well. I know CARB-X is a virtual organization today. And so I'm based in Rome, and I've used my network in Rome and the possibility of working, I think, both with the Italian Ministry of Health and Italian Ministry of Finance to really make sure that AMR was a priority during the G7 presidency of Italy. So we did organize we did partner with the Wellcome Trust, which is a private foundation based in the UK, to organize a very first lunch meeting in January, I think a couple of weeks after the start of the year, together with the Italian Ministry of Health, and the Minister of Health was there in person to discuss, together with a wide range of stakeholders, what the priorities could be for the Italian presidency with respect to AMR. And after that, we continue to provide support to the Italian government about anything related to AMR fundamentally. And the good news was that CARB-X has been endorsed by the G7 governments now for many years, at least since 2021, at the time of the UK presidency. So we are a trusted partner of G7 governments, and so we had a great opportunity to work with Italians to help them and work with them in terms of like what the expectations were at the international level on antimicrobial resistance.
That's great. So we see now that this actually bore fruit, because we know that then as a result of this interaction that you had, the government of Italy did commit funding for CARB-X itself, so $21 million. Canada previously has committed, we know, $6.3 million to CARB-X. And so what will Italy's contribution do with respect to the contribution in CARB-X, and how will it complement investments from other countries like Canada?
So it was a good news at the health ministers meeting in October when Italy announced a contribution to CARB-X. This was a decision that was already taken many months ahead, and in reality, the partnership between the Ministry of Health and the Ministry of Finance and CARB-X was the basis behind working together. And so this is also why we were invited to make a presentation at the G7 Joint Finance and Health Ministers meeting. The role of CARB-X is to support global innovation to address AMR. And so the way in which we receive funding and distribute funding is global. We receive pooled funding by governments. So when a government joins CARB-X, they usually join like the board of the initiative, And then they work with other governments and private foundations to set the strategic direction of the initiative. So we had like several funding rounds in 2023, 2024, where we really search for the best possible science around the world to address some of the biggest priorities in terms of AMR R&D, and the contribution from Italy will be fundamental to make sure that we have a pipeline which is large enough and diverse enough to address all the challenges that product developers face in the R&D space. I mean, I know this is a very difficult area, both from scientific perspective, from an economic perspective. And so we do expect that many of the projects that we support will fail. This is normal scientific attrition when you want to develop something completely new, completely innovative. And the only way to work at and address this problem at the global scale is to have a sufficiently large pipeline so that you can differentiate and diversify your bets fundamentally. So the good news was that both the contribution from the Public Health Agency of Canada and the Ministry of Finance in Italy were contributions were not tied to any specific priority within AMR. They were contribution to CARB-X as a global initiative. And so we're really able to use their contribution to place like the most diverse and exciting bets into the best possible science around the world.
That's great. Well, it's very, very exciting, and hopefully that we know that there are some fails, but with a large enough pot to start with, we'll have some successful candidates that get through the pipeline. So now going on to that's on the push incentive side. Going on the pull incentive side, we did notice that Italy will implement some sort of a reimbursement model that incentivizes innovation. So how do you envision this model taking shape, and how does it differ from existing incentives programs that have been implemented in other countries?
So what was very important to us was the announcements made by the Italian government at the health ministers meeting in October were a complementary set of push and pull incentives. I know we know that the solution to the market failures in AMR need to be both direct support to R&D in certain cases, but also significant changes in the way in which antibiotics are evaluated, valued, and reimbursed within G7 governments. So what we said to the very since the very beginning to the Italian government was that any significant announcement from Italy with respect to the G7 should be both about push and pull. The contribution to CARB-X comes from the Italian Ministry of Finance. The contribution to pull is something which is, let's say, slightly more complex, just because the way in which each country implement pull incentive has to be, let's say, slightly different, mainly because each country has a different reimbursement model, different ways to procure antibiotics and to pay for antibiotics. So what we know as of today is that the Italian government is planning to use a specific fund for innovative products that they did create a few years ago, specifically for medicines for oncology and rare diseases, and to make that fund a standard place for new antibiotics when they reach the market in future years. The challenge for new antibiotics to get access to this fund for innovative products was that the type of evidence that was required for new products was very high, because this is a place where you get usually higher prices. And we know well how clinical trials for new antibiotics suffer from some limitations related to the inherent nature of antibiotics are as short treatments that save lives already. And so the plan from the Italian government is to really to make new antibiotics reaching the market in Italy that target priority pathogens in the WHO priority pathogen list, give them direct access to the fund for innovative products so that they have several benefits which are related to being part of this fund. One of the most significant benefits, for example, is the fact that they are exempted from payback mechanisms that new medicines are expected to be subject to in Italy when there is an overpayment with respect to the national healthcare budget, for example. And so some of these benefits have been quantified between, let's say, 15 and 25% in overall in terms of of the pricing and reimbursement, which makes this, I think, an attractive move, I think, for some of the new products coming to Italy. it is important to recognize that Italy is unfortunately a country with very high levels of resistance. It's probably the country with the biggest problem related to AMR in comparison to other G7 governments. So the market for new antibiotics in Italy is not as bad as with other G7 governments, just because the epidemiology of the country is unfortunately quite poor. But we also recognize the fact that any sort of fair contribution by different G7 governments to a pool incentive has to take into account epidemiology as well. And the same way in which Italy may be contributing a little bit more than other G7 countries, it's also creating a risk for other G7 countries because the number of infections and the risk that having so many infections create, like with resistance in Italian hospitals.
Mhm. And what's the timeline for implementing the program? Is it effective immediately? Like they're applying this
So
program?
the challenge for the Italian Ministry of Health was that the fund for innovative products was created by law, and the access criteria for the fund were indeed like a normative document. And so while the announcement was made in October, the Italian Minister of Health is now targeting like the budget law in Italy at the end of December to include like a specific provision that will amend the original provisions creating like the fund for innovative products to make sure that new antibiotics will be able to access that fund in a direct way. So because of the way in which the fund was created, it cannot be just a government document. It has to be something that goes through Parliament, and this is why there still remains some sort of uncertainty because obviously it has to go through Parliament, but the majority of the government seems to be strong enough that this, as it comes from the government, should be safe.
Very interesting. Okay, well, and for us in Canada, we noted that with the move from the Italian government, that it was recognition of innovation, that they were rewarding innovation with this. And so what we talk about when it comes to pull incentives in Canada, that it's looking at access, but it's looking at rewarding innovation. That's really important because we have to revive the global pipeline. So with that end, transitioning to actually to thinking about now the G7. So did Italy always plan to prioritize AMR within its G7 plans? I mean, you talked about the meeting that you had earlier in the year. What was there interaction between maybe your group and other countries to encourage Italy to prioritize AMR, or was it always just a given that it was going to be a priority topic?
So AMR was actually a priority topic for the Italian presidency of the G7 in 2017 already. So there were reasonable expectations that AMR could remain as a priority for the G7 presidency in 2024. Most of the work for making sure that AMR is a priority for G7 presidency was done in 2021 and 2022 by the UK government and the German government. They really pushed AMR at the top of the agenda in the health track for the G7. And I have to say, looking at Canada from an international perspective, at the beginning of the year in 2024, the expectations were that Italy would do something on AMR, but that this was significantly a breach fundamentally to 2025 because everybody was expecting and is still expecting Canada to make AMR a priority. AMR has so significant impacts on many global health priorities that Canada had long championed, from sexual reproductive health and rights to immunization and women and girls. So we definitely achieved probably what more than what we expected at the beginning of 2024. The challenge now is to make sure that this remains a priority for the Canadian presidency as well. And we fully understand the fact that because of the political dynamics, and the elections potentially coming up in 2025, it is always difficult to run a presidency of the G7 during an election year. But we still have high hope and reasonable expectations that the Canadian government will lead on the G7 with respect to AMR as well.
Yeah, and so that's so where do you think if now we're going to pass the torch, what do you think the key priorities are from Italy to Canada and what Canada has to maintain to also then for the next G7 also in 2026? What are the key considerations that you would put forward for Canada?
So 2024 was a special year for antimicrobial resistance. We had a high-level meeting at the United Nations General Assembly in September 2024. We will have in November in Saudi Arabia like a ministerial conference specifically dedicated to antimicrobial resistance. And as we discussed, the AMR was a priority for the G7 meeting, the health ministers meeting in October, and also for the G20 health ministers meeting at the end of October. So it was a very busy and I would say productive autumn for AMR, with very different players, different multilateral fora that looked at AMR in different ways from different perspectives. The role of the G7 with respect to AMR has always been more on the innovation and the access piece. I know the G7 governments, G7 countries, they host some of the most important scientific hubs and research and development hubs in the world. And there is probably no one with the financial capacity to really, provide sufficient funding for different types of incentives for antimicrobial R&D. So if we have to distinguish between the role of, for example, the G7 presidency of Canada and the G20 presidency of South Africa, I would expect that it makes sense for the G7 to continue to maintain a strong focus on innovation and incentives for innovation, and to work closely with the G20 presidency of South Africa, where they probably will need to focus a little bit more on access and access in low middle income countries. This does not mean that G7 countries care only about innovation and G20 countries care only about access. The two are so intimately linked that there is no reasons to think that one is more important than the other. I know there is nothing to get access to if you don't innovate, but also innovation is quite, wasteful if you don't provide access to it. So it's more a question of how to coordinate multiple initiatives. But I still expect that the top priority for Canada will need to be on incentives. We know that there has been good work commissioned by the Public Health Agency of Canada in 2023, to the Canadian Council of Canadian Academies, specifically on how to incentivize both access and innovation in Canada. So we hope that this offers solid grounds and foundations for good work in 2025 as well.
Thank you. Very well put. And so going to my last question, so Kate, we are a member of civil society, and we really want to maximize Canada's role with AMR and innovation and leading up to the G7. So what is your advice to us in terms of actions that external organizations, us, but also other organizations in Canada that have vested interest in AMR, how should they engage the public effectively in G7 discussions to ensure that they're aware of these priority topics and what it means to them?
So a key element of our work in Italy was to engage with civil society and patient organizations, which were not necessarily directly linked to infectious diseases. So a lot of the work that we did was with, for example, patients organizations for elderly people that suffer significantly from drug-resistant infections. A lot of the work was done with cancer organizations because of the significant impacts that drug-resistant infections have on cancer patients. And more broadly, we work quite a lot also with other organizations which were more like citizens organizations to protect the national healthcare system, mainly to look and to address the big problem that infections can create to hospitals, closure of hospital wards, and the significant impact in terms of, for example, occupancy of hospital beds as well. So one key recommendation is to work with others within the healthcare ecosystem to explain and show the wide-ranging impacts that infections and drug-resistant infections can have on the system. So this is not AMR is not a silo within the healthcare system. It's a foundation of a successful and efficient healthcare system. So there are so many players, so many patients, so many citizens which are impacted by drug-resistant infections, and so there is a lot that we can do more in terms of advocacy and awareness raising.
Yeah.
I think that the second point is probably connecting drug-resistant infections to other long-standing global development, global health foreign affairs priority of the government of Canada. And this should not be difficult because, again, as I mentioned before, if you look at newborns and babies, this is the category of human beings which are most affected by drug-resistant infections. In reality, if you look at mothers and girls and sexual and reproductive health and rights, the rise of drug-resistant infections in sexually transmitted infections is very significant and very worrying. And also, only if you think about vaccines, I know vaccines have a very important and crucial role to play to address AMR. So there is so much that I think that you can leverage in terms of past priorities and current priorities, I think, of the Canadian government with respect to global health, and AMR bring them all together. So the challenge for a government that has a presidency is that there are obviously many different topics that can be selected as priorities. They need to pick one, and they usually pick one as an umbrella for other topics. So the question will likely be, will antimicrobial resistance be the umbrella for other topics, or will it be under one of the other umbrellas? So I don't think it changes that much in the end, but recognizing the fact that antibiotics are foundations to modern medicines, and that they are foundations to so many other priorities for the Canadian government, will be key and crucial, I think, for us working in this community to make sure that we keep AMR at the top of the agenda of the G7 in 2025.
That's wonderful. Well, I'm hoping that we'll have people from the Canadian government listening and listening to the advice that's been provided, and also for us to take on the advice and engaging, particularly patient organizations and organizations that also have an interest in global maternal health are really important topics for us to focus on. So thank you so much for participating with us today, sharing some insights. I think it'll be very interesting to our people here in Canada, but also around the world that have interest in this topic, the G7. So thank you so much, and see you next time.
Thank you very much.